Hello, it's Dr. Rhonda Johnson. Today is Thursday, November 17th, 2022. And today, folks, I am discussing measles. Yes, measles. Well, it turns out there is a measles outbreak in Columbus, Ohio. 24 cases have been confirmed as of today. That's up from 4 cases last week. Public health officials have confirmed measles cases at 9 daycare centers in and around the central Ohio area and at 2 schools as of today. Now, most of these cases were in unvaccinated children, and at least 8 children have been hospitalized. So what do you need to know about measles? Well, most of this information I'm sharing today comes from the CDC website. But if you don't remember anything else I say, remember one thing. Measles is not just a little red rash. It is a highly contagious virus, which can be serious and even fatal for small children. You know, measles spreads through the air when infected people coughs or sneezes, and the measles virus can remain airborne and infectious for about 2 hours after an infected person releases it in the air. So you can get infected simply by being in a room where an infected person once was. It is so contagious that if one person has measles, up to 90% of the people close to that individual will also become infected if they aren't protected. Now, globally, measles still kills more than 200,000 people a year. Mostly all of them are children. So what are the symptoms of measles? Well, there's about 3 phases. It first begins with cough, runny nose, and red, watery eyes. And then 2 to 3 days after those symptoms starts, you can see tiny white spots inside the mouth, on the roof of the mouth, and on the insides of the cheek. Then 3 to 5 days after that, after symptoms begin, typically the measles rash will appear with a high fever, usually around 104. Now, the measles rash is red. Sometimes it can be flat. Otherwise, it can be raised. The key about measles, it starts from the face and generally works its way down and covers the entire body. Now, kids with measles are sick, folks. Now, on very dark skin, you might only see the red rash of measles on the palms of the hands and the soles of the feet. Now, who is at most at risk? Children that are younger than 5 years of age, adults older than 20, pregnant women, and people who have immunocompromised systems such as HIV infection or cancer. Now, what are the complications of measles? Well, pneumonia is the most common complication and the most common cause of death in young children. But the dreaded one includes encephalitis, which is infection and inflammation of the brain. Now, measles can be prevented through vaccination, folks. Measles, mumps, and rubella, the MMR. Normally, it's given in 2 doses, starting with the first dose in toddlers between the ages of 12 to 15 months, and the second dose at 4 to 6 years of age. But during the outbreak, public health officials might recommend an earlier dose of measles, mumps, and rubella for infants at 6 to 11 months old. If there's community-wide transmission of measles, then public health authorities may recommend the second dose at 1 to 4 years of age. Now, the CDC has been called in to help with this outbreak in Columbus, and I pray that this gets under control soon. Now, parents, this is one more example why it's so important to get your children vaccinated. Measles is a vaccine-preventable infection. Please do not underestimate measles. That's my message today. As always, I hope you'll be safe and share this video with someone that may need to see it. That's my message today.